Boxes by Sarah Strecker. Medical school. 4 years of learning how to act and to think and to be a doctor. 4 years of seeing people at their worst, helping them, fixing them, saving their lives. 4 years of seeing the same things over and over and over again. 4 years of putting everything into a neat little box. And then comes the patient. Her symptoms don't make sense. She doesn't fit into that neat little box. Idiopathic, aka doctor, you're an idiot because you can't figure this out. So the doctor says psychosomatic. It's all in her head, implying she's the problem, passing the blame. It's 8 minutes per patient, and she takes 8 minutes to list her symptoms, and those symptoms cover gastroenterology, endocrinology, neurology, and orthopedics. 4 years of learning how to think means your thoughts never stray from inside that box. Sure, they taught you about rare diseases, Addison's, Chiari malformation, cystic fibrosis, Ehlers-Danlos, Guillain-Barré, Hirschsprung's, Huntington's, Klinefelter's, Tay-Sachs, Williams. But the axiom from medical school that's stuck in your brain is when you hear hoofbeats, think horses, not zebras. Horses are more commonplace. Zebras are rare, you were reassured. You'll never see a zebra in your office because a cough is the flu, not cystic fibrosis. Stomach aches are gastroenteritis, not Hirschsprung's. Chest pain is a heart attack, not an Addisonian crisis. So, when you encounter your first zebra, you don't want to say psychosomatic, but she's seen a lot of doctors. Red flag. She takes a lot of medications. Red flag. She's anxious about her health. Red flag. But her symptoms seem so real. She suffers and you can't make her better. You can't even check a box on the insurance reimbursement form. I first came to you at 18. Dislocated joints, fatigued, symptoms in every category, with a binder full of normal lab results and an extensive but odd medical history. You brushed me off, never believing I was really sick. I was malingering. I was a hypochondriac. I was self-injuring. You recommended therapy, and I went, desperate for some relief, praying somehow I could fix it and finally start to feel better. Then 4 years later, I went to medical school. And on that lecture on rare diseases, first year, sitting in class amongst the freshly pressed white coats, I looked up at the PowerPoint and saw all of my symptoms, arranged in neat little boxes, under a title that said Ehlers-Danlos syndrome, incidence 1 in 5,000, and my years of suffering had a name and an ICD-9 code. I was 756.23. I had a genetic collagen disorder. It was not psychosomatic. My years of suffering were vindicated. Tears ran down my face in that hall because it took a lecture on diseases we would never encounter in our careers as physicians to get a name and a neat little box for me. Medical school teaches you how to be a doctor, but during those 4 years you forget you're treating people, not just diseases, and people don't always fit into neat little